For our final question today, Dr. Mingle, let's go back to the subject of APP+. What can ACOs expect from Mingle Health for help with this proposed change?
Well, we have you covered for Medicare CQMs. For us, Medicare CQMs are business as usual. It's the techniques we've always used to do quality reporting, with the minor addition of this is a Medicare filter. This is a Medicare patient filter applicable to the denominator for every measure. So we will continue our full support of Medicare CQMs as long as it's an acceptable option for you to submit the APP. Now, we can and do use all electronic sources of data that ECQM providers can use. So we will continue to use those electronic sources as much as we can to make your Medicare CQM submissions. And we'll use that to help you identify the holes in your electronic data and fix it to make you able to use ECQMs. Now, we are renewing our own certification for ECQM submission, and we'll be ready when you are to switch over to ECQMs from that Medicare CQM platform. So we can make the switch with you to ECQMs whenever you're ready for the switch. Now, I'm not actually in favor of removing MIPS CQMs. I think they're superior in many ways to ECQMs. ECQMs, in my opinion, are a better measure of your technical capabilities. They're a better measure that your EHR is able to do the things Medicare thinks it should do. But I think MIPS CQMs are a far more accurate measure of quality that's accessible by means of cost and capabilities to all ACOs of all types and sizes, all practices of all types and sizes. And I think it'll be bad for the population, bad for the healthcare providers to lose that option. Now, they're not proposing to remove it from the MIPS system, at least not yet, or from the MVP system. But I don't think it's a good policy particularly for ACOs. I think it's harder for ACOs to do ECQMs, and it will be harder for ACOs for the foreseeable future than it is for solo doctors or MIPS groups. So keep an eye on our coming episodes. I plan to dig into more detail into this, coincident with my submitting comments to Medicare about my opinion on that.